Hello there, I'm DJ Lady Loy on Gold Standard Radio, and I talk about a number of different topics. I can't even categorize them now, but they have nothing to do with the radio station. I am speaking to you as an individual DJ, and these thoughts and opinions are my own. And I wanted to talk a little bit because AI is around so much, DeepSeek, ChatGPT, and someone's mother in China used ChatGPT to diagnose her because doctors were so overwhelmed. I want to tell you a little bit about that relationship between AI and people who are desperate to get information when they can't get the human. So I've put when AI becomes doctor, what happens? What happens when the compassion is coded. There is something quietly unsettling about reading a headline like DeepSeek is humane. Doctors are more like machines. My mother's worrying reliance on AI for health advice. And then realizing it is not an exaggeration, but a lived reality for someone's beloved parent. In the story from The Guardian, a woman in eastern China, a 57-year-old with a kidney transplant, a life shaped by chronic health needs, finds in an AI chatbot not merely information but companion in her medical journey. What started as curiosity turned into emotional reliance, trust, and eventually something resembling friendship. She tells her daughter she feels heard and that AI is humane, while doctors, in contrast, feel rushed and remote. Imagine that. Not just asking a machine for health guidance, but preferring it to the human doctor. Her doctor manages 3 minutes per patient. DeepSeek stays on the sofa with her for hours. It interprets lab reports, suggests dietary changes, encourages her when she feels low, and reassuringly affirms her experiences. For someone who has travelled for days only to get glossed over, the appeal is almost hypnotic. Yet this intimacy between patient and AI is where the tension lies. From afar on a sofa in the UK or anywhere else, we might say this is an extreme case. This is China. Overloaded hospitals, long waits. But look closely. Isn't there an echo here? Our own health system, the NHS, has chronic overstretch, long waiting list, tight appointment slots, referrals that take weeks or months. When someone is anxious, dealing with complex chronic disease, juggling prescriptions and multiple symptoms, what do we wish for? Time, compassion, availability. And when humans can't give that, whether from constraint or burnout, technology often steps into the vacuum. Sorry. Yes, AI like DeepSeek can do remarkable things. It offers instant responses, picks through data fast, and because it doesn't get tired, it feels available. Its language can be warm, supportive, affirming. It even uses emojis. For a lonely, anxious, or discouraged patient, the psychological effect isn't trivial. It fills the emotional gap left by time-poor clinicians. But here's where reflection matters. Beneath the comforting tone, there are structural and ethical hazards. 2 US-based nephrologists looked at mothers' DeepSeek interactions and found serious errors, wrong tests suggested, a misdiagnosis conflated with a rare disease. These are not trivial mistakes. They shape decisions about medication and the course of treatment. In China, DeepSeek has been rapidly deployed and integrated in hospitals, helping with diagnosis and treatment recommendations. But real data on outcomes is limited and transparency is thin. Hospitals touted performance but seldom reported risk assessments publicly. Medical safety and algorithmic oversight lack behind deployment. And there are global issues with some versions of DeepSeek that go beyond medicine, from data privacy and server location, concerns to censorship of politically sensitive topics, and regulatory pushback in Europe and elsewhere. Our healthcare system in the UK isn't perfect, and people are increasingly turning to online symptom checkers, health forums, generic chatbots, even niche medical AI tools, often out of frustration, anxiety, or lack of timely access to care. DeepSeek itself has been discussed in the UK in the context of security scrutiny, which shows we're not isolated from global AI trends. Source of that one is Reddit. The pros of AI in medicine are real and meaningful. Rapid access to medical knowledge, symptom interpretation around the clock, synthesis of large data sets, potential to flag overlooked indicators, and support for clinicians under strain. It can act as a second opinion, a reminder, a translator of medical jargon into human language. It feels unbiased because it doesn't wear white coats, it doesn't rush, and it doesn't mirror some of the human professionals' brusque manner. But there are some cons too, serious ones. AI doesn't actually care. It simulates empathy. Its answers are only as good as the data it's trained on, and the safeguards built into it. It can hallucinate, confidently assert plausible but incorrect diagnoses. When it gets something wrong, the consequences are not a quiz score lost, but potentially health harmed. Large language models show gaps in safety and bias assessments. Many clinical studies haven't yet validated them on real patient data in controlled environments. Many clinicians recognize AI's potential as a tool, not as a replacement. In surgical and clinical surveys, healthcare staff see AI as an assistant, welcomed for efficiency and data crunching. But they also worry about over-reliance, skill atrophy, misdiagnosis, data privacy breaches, and legal liability if AI guidance leads to harm. They emphasize, I wonder what would happen then. That's an interesting one. Anyway, they emphasize that medical decision-making needs human judgment at the centre, not at the periphery. Some clinicians fear their role could be devalued if AI is used to replace them rather than to complement them. Others see opportunity. If AI takes on repetitive tasks, clinicians could focus more on human interaction. That has to be the promise, not the replacement of humans wholesale. The Guardian story nails a modern paradox. We are hungry for compassionate care, but we are tempted by machines that feel compassionate. We want the availability that AI offers, yet we fear the risks of decisions made without human oversight. That tension is the nature of the beast, not just in China, but globally. It's the friction between what technology can do and what ethical, trustworthy, equitable care looks like. We need systems that augment human professionals, not substitute them, that deliver accurate, safe, culturally competent guidance, that protect patient data and privacy, that are transparent about their limits, and that help clinicians not undermine them. At the end of the day, we want AI to be a force multiplier for care, not a force friend. The mother in China turned to DeepSeek because the system around her was overwhelmed and unresponsive, and that should give us pause. Before we rush into an AI-mediated future here in the UK, we must ask, are we fixing the healthcare system with technology, or replacing compassion with a code? My footnote here is the rise of AI in healthcare from China to the UK illuminates both the promise of technology and the human needs that technology alone cannot satisfy. True progress lies not in choosing between human doctors and machines, but in weaving both into a system where patients are heard, understood, and safely cared for. With